Hi everyone, welcome to researchmd.com. Another scientific presentation today. Again, all of our recommendations, all our presentations are purely 100% science. If there is no scientific study behind it, we will not present it in this presentations, okay? Remember that. Today we're going to look at, does yoga help in primary dysmenorrhea, my friend? That's the clinical question we're going to ask today. Again, my name is Pramil Cheriyath. I'm a program director, internal medicine transitional residency. I teach medical students and medicine residents on a regular basis, and I'm also assistant professor of medicine to major universities. So let's get into our subject. So everybody know what is dysmenorrhea. It's a recurrent painful lower abdominal cramp that occur with the menstruation. Very painful, and the most common gynecological problem of women in all ages and races. And primary dysmenorrhea is defined as the menstrual pain without diagnosed pelvic pathology occurring with ovulatory menstrual cycle. So there's no pelvic pathology associated with primary dysmenorrhea. So looking at the epidemiology again, usually typically 6 to 12 months after menarche, with the peak prevalence in the late teen or in the 20s. Reported prevalence varies from 16.8 to 90%. Very, very common, very, very high. So now we have to do some literature search, and we look at what is a clinical question. Does yoga helpful in primary dysmenorrhea? So we found this great study, scientific study, when you talk about meta-analysis of randomized control studies, looking at the benefit of the yoga, okay? So objective or hypothesis to assess the overall effect size, the impact of yoga on the menstrual pain in primary dysmenorrhea. So when you talk about, it's good to know what type of study. It's a meta-analysis of randomized control trial. That means there's no other strong evidence greater than this, okay? You got meta-analysis of the randomized control. So you're taking a lot of randomized control and then combining them to the meta-analysis. Very, extremely strong study. I don't think anything above that. So overall effect, what did they find? The impact of yoga program on menstrual pain and dysmenorrhea was high, with a standard mean difference was minus 2.09 with a p-value 0.01 among the effect size with the 4 trials. So different yoga poses they used, again, Surya Namaskara, cat and child poses, prayer pose, and cobra pose. So you got the nice graph to comparing the yoga with the standard therapy, and you can see clearly the diamond kind of move without touching the 0 right here. Very, very significant. So based on this meta-analysis of randomized control studies, clearly we can say that yoga is beneficial for the patients with the primary dysmenorrhea. Okay, thank you so much for watching. We'll be back with another presentation soon. Please subscribe to our channel.